Y'all, we need to talk. Specifically about fleas, ticks, and mosquitoes. I know that depending on where you live, you may not deal with any of those. But if you are in the Northeast or pretty much anywhere else in the United States, they are a problem for you and a problem for your pet. It is very, very easy to prevent and avoid the diseases that fleas, ticks, and mosquitoes cause for you and your pet using prevention, whether it's monthly pills, every 3-month medications, or even there are some once yearly medications out there. Talk to your vet, see what's best for you and your pet. But just a PSA, it is so much easier, less time consuming, and definitely cheaper to prevent these things than to pay for them later. For example, it takes approximately 3 months to break the flea life cycle. Yes, we have a pill that can kill all adult fleas on your pet within an hour. However, your pet, if it has been inside of your house, has been dropping flea eggs that then turn into flea larvae all over your house, in your carpets, in your bedding, in your cushions, everywhere. It takes 3 months to get rid of them because you have to wait for the eggs to hatch into larvae that then turn into fleas. Don't deal with it. I would burn my house down. Another example is heartworm that comes from mosquitoes. Infected mosquitoes bite your pet, transfer the tiny baby heartworms into their bloodstream, and then the cycle takes, 6 months or so to really kick off. But once your dog is infected, or your cat for that matter, is infected, it is a long, and I am talking long, year of treatment and monitoring and exercise restriction. And at any time, one of those heartworms, especially when they're being treated, especially when we're doing our best to kill them off so that they don't kill your pet, could dislodge out of the heart or the lungs, go swimming around, and cause a blockage in one of their major vessels, and essentially cause a stroke. You don't want that. You don't want that. And I know I sound passionate here. It's because I am. These are very, very simple things to prevent. Give the prevention so that you don't have to pay for the cure. The other thing is ticks. Again, depending on where you live, ticks may not be an issue, or they may be so rare that you don't have to deal with them. But up here in the Northeast, ticks carry most commonly Lyme, Ehrlichia, and Anaplasma, usually in some sort of combination. We don't have singular disease ticks anymore. They usually have a party package. And you're like, oh, well, I had a friend who had Lyme disease and it didn't really affect them. Yeah, that's fine. That's fine. Sometimes Lyme doesn't really affect too many people. And that's okay. But for most dogs, it causes crippling bone pain. Anaplasma can cause extreme flu-like symptoms. And then there's Ehrlichia that goes after the red blood cells and frankly makes your dog anemic so fast, so quickly that they need a blood transfusion. And how can we prevent this? By using prevention. Just do it. Do it. Yes, and I know you have concerns. I know you heard stories about such and such had a seizure after they gave any sort of prevention. It can happen. I'm not saying it doesn't. That's why there are warnings. But this is also why you talk to your veterinarian, so that you can figure out which option, because there are so many of them, which option is best for you and your pet. so that it can be the safest possible preventative that still is effective. You don't want to deal with this stuff. Please talk to your vet. Please figure out some sort of yearly covering the entire year. And I am talking to you. I know some of you think that mosquitoes don't exist in the winter. It has been a very warm winter the past couple years, and I have seen mosquitoes in January. Don't do it. Don't stop in winter. Use the prevention year round. Anyway, talk to your vet. Figure out options for you and your pet. You will thank me in the long run. This is stuff that you do not want to deal with. Anyway, I hope you and your pet have an awesome day, and I will talk to you later. Bye.